Hello, I'm Dr. Marla Shapiro, and I'm a past president of the North American Menopause Society. And today I'm joined by Dr. Kling. Tell us who you are.
Thank you so much for having me. My name is Dr. Jewel Kling. I'm a women's health internist and the chair of the Division of Women's Health at Mayo Clinic, Arizona, where I have the privilege of providing primary care to women, as well as consults in the area of menopause, sexual health, and breast disease.
So all of those three things are what we want to bring to the focus as we talk about safety of hormone therapy. Despite the fact that data has evolved since back in 2004 with the Women's Health Initiative, those headlines for women in terms of safety are still front of mind. So as healthcare practitioners, how can you counsel us and coach us into having that conversation with our patients?
Yeah, no, this is such an important question because oftentimes it's our patients that are asking these questions about risks. And everything we do in medicine is about shared decision making and looking at the risk-benefit ratios. So that's often how I'll approach a conversation with a patient. I think there's probably three things to keep in mind, especially when you're talking about somebody with hot flashes and night sweats and menopausal women that's looking for treatment, is first of all, that menopausal hormone therapy is the most effective treatment for hot flashes and night sweats. Second of all, that the risks associated with hormone therapy have to do, most of them, with the timing of initiation of hormone therapy. Specifically, that for women less than age 60 or within 10 years of their last menstrual cycle, typically the benefits of hormone therapy are going to outweigh the low risks associated with hormone therapy.
So we really want to focus on that notion. We've used that phrase, window of opportunity, and
Absolutely.
it really is a window because the window
Yes.
does close.
Yeah. Yes, it does. Yeah, once you're over 60, if you haven't started on hormones, then that starts to get to a position where the risk, the cardiovascular risk, the stroke risk, may outweigh the benefits of treating the hot flashes and night sweats. And you may see in that context that you'll talk about non-hormonal options or other treatments for her vasomotor symptoms. Now, the third thing just to remember is there are absolute contraindications to hormone therapy, and it falls to us to really investigate that with our patients and make sure we've identified those. So for example, like if you had breast cancer or another, hormone responsive gynecologic cancer, those patients are going to benefit from a non-hormonal option for their vasomotor symptoms.
And all our blood clot patients, for sure.
Yeah, absolutely. I mean, there may be a little bit more complexity there. So patients that, for example, have a provoked blood clot, not other risk factors, you may find yourself discussing really relying on that shared decision making and risk benefit consideration for a transdermal
So let's focus on the
formulation.
average woman, the one who doesn't have active liver disease or some other big risk factor, who still is a little bit anxious about breast health. That's one of the most important things that we hear. Not so much cardiovascular and not so much stroke from women, but at least from my patients, it's always, is this going to give me breast cancer?
Absolutely, you're right. That's the concern that our patients have when they come into the office. And it turns out that the relationship in menopausal hormone therapy and breast cancer risk is complex. And I want to talk to you about that a little bit, but I think the overall message needs to be that the risk is low. And to emphasize that with patients, that really women that are at risk, the amount of risk is about the same as being sedentary or being obese. So it is a low risk, and for women that are having significant symptoms that are impacting their quality of life, many times, again, that benefit is going to outweigh the risk.
Okay.
But a couple of just quickly complexities with that relationship is that it looks like it may have to do with the formulation of hormone therapy that's used, as well as if a progestogen is needed. So specifically, if women have a uterus, so they require progesterone to protect against endometrial cancer, based on the Women's Health Initiative, their 20-year follow-up showed that those women were the ones that had a slightly higher risk of breast cancer. However, women that were only on estrogen compared to placebo actually had a lower risk of breast cancer compared to placebo.
And that's often something that doesn't get out there, or as healthcare practitioners, we don't say that to women.
Isn't that interesting? Yeah, and that's pretty powerful. Not only did they have a lower risk of breast cancer, they actually had lower mortality related to breast cancer if they did get breast cancer. Now, there's some other factors that may have led to that, but I think that just emphasizes that it's not a black and white relationship.
So when we talk about, that risk of breast cancer, particularly being so low within the first 5 years, women often think and still have that messaging that there's a mandatory stop date. I've done 5 years, I'm done, to the day, off I go. So talk to me about that in terms of risk communication.
Yeah, and you're right, you bring up another good point that it does look like duration of therapy may have influenced that risk. But it was after that 5 years that we started to see that slight increased risk, but it's still a low risk after that 5 years. And so I think as in anything we do in medicine, and as we look at kind of that shared decision making again with menopausal hormone therapy, at that 5 years, it's having a conversation with that patient and saying, how are you doing? How are your symptoms doing? And if she would still benefit from continuing on hormone therapy, making sure that she's doing other things to reduce her risk, like healthy lifestyle habits, and doing her breast cancer screening to be able to identify anything if she were to identify or have something happen.
So that brings an important highlight in terms of what you're saying, that when we talk about the window of opportunity, it's initiating under the age of 60, but if you're on menopausal hormone therapy, 60 is no longer a magic age anymore,
Correct.
is it?
Yep. Yeah, exactly. That's an area we don't have a lot of data to guide our clinical decision making there, but I think the message to know is that we don't have to just stop when a patient turns 60, that again it's reevaluating, see if she has other risk factors. Has she developed hypertension, or has she had a blood clot, for example? I mean, things that may reevaluate, so you have to change your treatment plan.
Right. Things are always in flux. When you're prescribing menopausal hormone therapy to a patient, if they don't ask specifically, what's the risk of my therapy, what type of guidance do you give them?
Oh yeah, typically I will go through the discussion of the risk and benefit. What I've started doing more recently, recognizing that oftentimes we focus so much on the risks and not so much on the benefit, is presenting the benefits first. Really talking about the fact that hormone therapy is the most effective treatment for their hot flashes and night sweats, and not to minimize that. I think a lot of women have been told or think they just have to tough it out and live with hot flashes and night sweats, and don't acknowledge how that impacts their quality of life. This is the time that many women are hitting their stride in their careers or with their families, so spending some time really focusing on that. And once I've done a really thorough evaluation of their medical history to make sure there's no absolute contraindications, reviewing those kind of lower risks so they're aware of those, as well as accompanying that with a discussion of things that they can do in their day-to-day life to lower those risk factors, like regular exercise, a healthy balanced diet, not smoking, minimizing alcohol.
Such good information. Thank you so much for being with us today, Jules.
Absolutely. Thank you so much for having me.